ebano apomunse apomu ayaresemu ni apomuden nsemu a ba dodo na so da ka yidi se esi to be kan hobom na yedi hudwuma enso ukoto aba ese wonya nyina so soronko a wo de beto aba no empanimfo mienu no omomhwan na yewo gidi wo ne mu se obetumi de yakompempe so ebeboan asoman oman we akaye no menyina esi prekope ne de pese ye nyina ye wi a kamenji ni senka fie na bi e ba koto aba de nti ye kokoto aba fie na bi ne se ye kakra ne ya sese ahwe bebia ye duru ya ye bia ka ho ene bebia gina yi hwan ene ye gidi se obetumi de yakọ abato no so koto a onyina so ne se penifo mienu no kakra na wo de hye o monsa no ekwan be no mutumi e de fa so Ghana ya pomuns di nsem ne ya yaresa ho nsem pa se ye ka ho nsem a and I always say it and bia bi hye obi a meka say there is no doubt say between MPP and NDC no MPP ya wadwempa ne mapa bebre mo my way na eto de bia nipa hofo no eti say wahwani na wa to boase a bon say ahofo na bia ema wode eteki decisions bi ba edwuma pa de e ben say your opponent betumi de omo atoto yen embra MPP edikan ye ba ben wo my way mu Aya former President Kufo or serving between 2001 and 2000. That was the first time. Ghana had promoted some bebre health financing. A quite fast way you share now promoting some Ghana Yarisa, Ghana for to me, a common or Pampenin Kufo epidemu. Health infrastructure or Mampenin Kufo epidemu. Making sure say answer ye be 2008, December no. Na Ghana bibia obeto ya pomodin nsem in the year 2001 no na akone nimbebre. But like I always say, where MPP won under President Kufo took this country in terms of health delivery, anka ye bomodia at that time in the year 2009, anka ye unfold for propaganda, any twist, any spin at that time anka ye pija ye hukra ko prekope than where we were. Because by the time Omampeni Kufo air corner, then your MPP 1 year nanka yes set your home on the part of growth and the health. Now 8 years now, young baby, no one saying now, and I'll prove that to you tonight. Me prove a friend is saying, sir, points that me making to you tonight. And the point is that we as a government, as an MPP government, as an MPP political party, on every ground, from health infrastructure to health financing, we have done way better than the NDC ever did. In fact, Omampeni Kufuor's administration is focusing on upgrading healthcare infrastructure. That was one of the focus. EBCC hospitals, ACC clinics, ACC chips compounds, ACC polyclinics. If our hospitals were by an enkuyi or refurbishing, uplifting, he put a lot of effort in ensuring, say, medical professionals training, and then to keep them in this country, a lot of our medical professionals, they didn't want to go into the hinterlands. Rural communities. Omampeni Kufo had to put in place a lot of interventions to ensure say they are attractive for them to go. In fact, he put in place a lot of campaigns and interventions. Not certain diseases and illnesses be how my way. He had to do so much work to ensure say another ase. Before Omampeni Kufo ebeba abetena konyaso na MPP abetena konyaso. If you recall, on my way na maternal mortality statistics on maternal mortality. In fact, that was a time you'd realize say your kind budget parliament mami for any year mami dodoa echo awards wo finance minister bejina parliament na wabobo na wakase afili yadi na percentage we than the previous percentage. That is how bad our health system was, and it was purely based on one reason. The reason was that we had a very poor system in this country. say wo kwako wo a unni sika wo be tua doctor no ana hospital no real time a wo be de fie wu nti na awofo ne bebre ye ma menum bebre no awo kana odade mu odampa so ochem obechem a kopem se moje tu ama ontumi ye ho hwe na fe de America se de ne hospital wahwe ni obedwo na obedu hospital no no ma hwe omo nkwa nti ema quack doctors ni omo mogigi a wo fie ni nkurase no ebedoso. Why? Because the cost was too much. That was the days of cash and carry. That were the days and now crazy I want to be in a hospital and it cost a lot of lives. In still bet. In fact, at that time in this country, I walk in hospital a country and then pipe. And when Akufo realizes that we cannot run a country like that until quickly, the free maternal care a buyer. And what free maternal care basically did was that making sure say on my way okwakowa ehun yasa obe physical preocupe na ode akọ hospital akwako aban etua saka no emaw se ne be ya wankasa obetumi akọ without any difficulty. But monkai bibi the same people omoni e pre akonwa ni yanu omoni e pre akonwa ni when this free maternal care was being introduced at the time ayedeba on my way they said it was not possible. But we did it as a country. And Oman Akufo at that point realized, if we are going to improve on our health situation in this country, then it's not just infrastructure. It's not just putting up training schools. It's not just training doctors and nurses. But we need to ensure that health financing is dealt with once and for all. Senior Beya, si yakase on my way, ya pomudin hustem kwenimwa health financing and so ekan. On my finish as 2001 man for by na Ghana on my way or or how be there so a lot of people were struggling to even fend for themselves in a day. And so this can call the beko ayarsabia and so yeah the cash and carry. That was the time I said now kunya accident near foul. Every accident in the Dukudu hospital. Not doctor for the monsa to two bottom. Now omo inyeska adebechi we nisu better na o wasamando webu. Because you needed to pay at all times before you are taken care of. And then Oman Akufo decided, say, no, we had to introduce a national health insurance scheme. And this national health insurance scheme significantly changed the face of health delivery in this country. It believes a deadly cash and carry system nana NDC for a on my way console. It be free. And for the rest of our lives, since that time till today, the lives of our healthcare delivery, the lives of the Ghanaian person when it comes to health services access, has never been the same. But of course, as usual, like it always happens, when the national health insurance was being introduced, these same people, these same NDC people said it was not possible. In fact, at the time when your parliament, Akoko pray, a friend is saying, Akoko pass a bill for the National Health Insurance Act. In some people, they said we are just almost say MPP for year to 2 foot penny and yeah, they have a basso until we introduced it. They said so many things. They put up across so many things. This is them. The minority boycott proceedings on health insurance. 31st July 2003. The minority in parliament had decided to boycott federal committee proceedings on the national health insurance, which began on Tuesday. And they were telling us at that time, said, the decision to boycott national health insurance, was in the interest of the people of Ghana. And that they are protecting our interest and defending the interest of the people of Ghana. This is what they said. And there are points, and they say, on my Niska, at that time, I had the health insurance. And see, almost for Monkaho, I don't know, MPP, Bambeka say, before my Nisika. Na ye tuya Ghana ni bia obekọ hospital so occupy say they no honka, so they will not agree, so they will not support. Let it be put on record tonight. Like I said, on the next chapter show, it's fact only that in the year 2003, Anna MPP abansi the national health insurance eba. At the time na cash and carry kum Ghana for. At the time na cash and carry essay on my way ehwe yasedo. NDC for 31st July 2003, Thursday, minority boycott proceedings on health insurance. On the reason they say, Omu protected the interests of the people of Ghana and defending the interests of the people of Ghana. Why? Because according to them, on mining needs to their health insurance, and that any possible da say on mine betunia for Nisika now Ghana ni biya area our cost person need to yanka almost any possible to member so in terms of they didn't want to be part of it. That is what the NDC and their followers did to us in the year 2003. They even went on. The NDC accuses government of deceiving Ghanaians. I say the National Democratic Congress on Tuesday accused the government of deceiving Ghanaians on the National Health Insurance Scheme. The party said the government was in haste to pass the bill because the pressure from the IMF to fulfill the agreement has reached with the fund to include a 5% increase in the VAT in 2003 budget. To achieve this, the MPP imposed a 2.5% VAT on petroleum products. Hence, the near 100% increase in the price of petroleum products announced in January 2023. Moses Asaga, spokesperson for finance. So this is it. Omanpenin for the MPP about him say, adenti na yare bogana ni sorti bumpugu se ote sugakope se ote asin so ote twifu praso na wako ayaresa be nyua me no ka say awoti fie ubusu ni bi ebia owe krum na ne ho aka na empofim ese de no ko hospital according to the NBC no ese nipa ne wo sika hye no ho obetumi di akọ hospital na wetumi di tuaka anye saa dia emeyefa on mine sika nhwe no mabenu ko fase de bi ene say ade ne yemo bia contributing kakran ne yefam bebom ne yefam to foto bi mu se ne be ya se wo yare a na wokọ wan yare a yede wo so foto no wo so de na ka obi ho ene po ankasa de ne sa tu botomu wokoto nsu a yede kakra vat kakra to so wokoto jena yede kakra to so na etumi aboa na Ghana ni bi eti de bi etumi nya ansa because ebusuafo dia ye kɔ be nyina yi ye nyina be gya tum se be bie ni wa esen ayaresa school nya ensen ayaresa adwuma nya ensen ayaresa ye chiche sika ma okra emu nya esen ayaresa. Everything we are doing, the ultimate of everything we are pursuing as a country, and to ensure say we have an efficient, effective health delivery system that would ensure say wo aname and I busu ni bi ho ka immediately no ebetumi ahwe no. But the NDC kicked against it. That is how bad the situation was. And if you pay close attention to the NDC that we are seeing today in 2023, you'd realize that 2003 almost yet different from the NDC we are seeing in 2024. The same people. So you see, and yeah, and I'm about kicking against the policy view. It is out to say NDC4 are kicking against free senior high school in 2016, 2017, 2018. In 2003. It is a massive 4 year in 2024, 2023, 2017. You should not be surprised. And remember what they said in 2003. They said, almost kicking against national health insurance because they were defending and protecting the interests of the people of Ghana. And these are the same people causing all manner of difficulty for this country in parliament. And the same phrase we are defending and protecting the interests of the people of Ghana. Now look at this. 2008, 5 years later, after they told the people of Ghana, say health insurance, MPP ain't to me yet. MPP say, Chechira ya baye no, almost say, and we ya, if I so be able to, yeah, Mamma Quine, I'm introduce a friend is saying, VAT, and find your health, and we'll be into me as one for so. 5 years down the line, the same people, when I fed your mom who say, Ghana for near health insurance and all, cash and carry free, Mammy for a quite was so air free. In Colorado, air woo a warm air coffin, Mammy for a woo a was so air coffin. Ghana for promudin some near some air costume. All of a sudden, quickly, Yakotwaba, August 2008. Akabaya 6-7 months we about to Obaso. And the NDC for now almost kicking against health insurance. No? This same group, they come back and they say NDC to introduce once for life insurance premiums. Can you imagine the hypocrisy, the inconsistency, the contradiction, the deception, and throw and contopo and nada kokofu bobo subaino efi omo nananom na abedu omasefo aye kan wonsem. So you see the connection. Enti eney say what is NDC ni catch us say oh free SHS na you say 2008 ye demonstration ti ano 2008 ye advert mako 40 ti ano no ene omo catch us say oh yes mo free SHS no ye ditum oh ye ni free SHS no ya adwen montuma ye esramo ye ba ye fa ye sanka. The people who said they will cancel free SHS, the people who kicked against free SHS, the people who said free SHS was not possible, first almost say enya the papa ye be mo dey buy na afi do mo say ade no kra enya fe afi do mo say quality no kofam exam results ne buy na nkola na ya ade no afi do mo say nkola no kro mu wiaye. The same people now akabe 6 months ekotoba omo nam nkrase omo nam afiefium afi do mo say free SHS no kra de yes ye ba ye beto aso ye be ye the same scenario na mentwe madwen ko bribi so eto de bi ne ye ka bibia enye se bia ye pese ye kan ye ka keke o ye catch them say the NDC kicked against free senior high school. So if they come and tell you say on bet to us oboboa me do ye change in the year 2008 after NDC had kicked against national health insurance, they came back almost signed by BM on the catch Ghana for 5 years later because we say Ghana for near Agyapong this is free SHS ye the bomb kiki against after the one say Ghana for near Agyapong into money na launch after the ye bet to us ye the big crowd back home ye the private schools back home ye the way back home. They came to tell the Ghanaians 5 years later, after kicking against health insurance, say, I fed the I didn't cry money. And I'm worried. Ye bar. Health insurance na eba na ye kutia ya na ye se yem peno. I fed the monto abama ye sremu, samutumaya. Ye bema motuya premium bar kope once pe utuya bium. Omo years our promise in 2008. It's in their manifesto. Mr. Mu. 8 years of NDC in power because it was based on some of these lies. And ye two about more. Ghana for say health insurance here the papa. Ya na renewal so na premium no a hard dream 12 cedi 14 cedis no a year hard dream into no obi say obo be no one time there. Oh we mo no buy be inform ntiranchen ne yentoma we mu. So we actually voted for them based on that. After we voted for them, Ghana for 2009 emba 2010 emba 2011 emba then Ghanaians got angry. Mobekaya and I go first started say na health insurance one time premium na we mo say bo mo fambe because I can tell you without any doubt say Ghana for school some any of my yare some sound some endiagro. They were very keen on it. And Ghana first started to me say one time premium now mo share about 2008 no. Yes some fambe they couldn't do it. They were lying. They didn't believe in it. It was false. It was deception. Omu chantro, no mu yiji no mu dada Ghana for. Enti afeno 2011 Ghana for pressure the course when afeno say NHIS, please go back. NHIS to be introduced as a NHIS one time premium to commence. This is 17 November 2011. The one time premium payment policy under the National Health Insurance Scheme will commence. The Minister of Finance and Economic Planning, Dr. Kwabena, before has stated. He did not give the specific date of the implementation, but it is certain that the project will be implemented by the end of 2012. Fellow Ghanaians, as at the end of 2012, Anibia, na NDC4 at the one-time premium abana. This is the finance minister speaking in 2011. 2012, they came to give us more promises. Return of cash and carry, NHIS is booked. This is December 24, 2013. Until by the time you year 2013, no more for one-time premium number. Almost health insurance. Until December 24, 2013, now a lot of Ghanaians who do health insurance at the core hospital are useless. Now health insurance card, no, for so into me here, they collapsed it. The same people who, until Osha South tangents here, you now Osha or massive and they are any more yeah, they are much share quiet into me. Do you see any difference? Do you see any difference between the NDC in 2003 kicking against health insurance and then 5 years later coming to lie to the people of Ghana and say, oh, I didn't pay. You cry, then one time premium. What is the difference between Omasifo and Omodelis? They kicked against free senior high school, fought free senior. In fact, NDC for denigrating Omagu free senior high school fee, SCOBI or my room. Then to 2024, ye kotwaba omo say Ghana for ni je of all of a sudden they are promising us an enhanced free SHS. The people who said free SHS was nonsense. The man actually told us, say, ono no kra 2 billion cedis anka. All from quiet secondary school education free. He said it. It's on video. And me wasiaba. And you made Dennis. And you made miracles. And I made that TV so my culture say, I don't know all cannot dada woo. Me chow di anina nanom a year. 90% of omo mudi said mudi boni from 2003, 28 to 2008, 2011 bepemone omo mudi saboni by fighting free senior fighting national health insurance and coming back to deceive us. Said they were going to make it one-time premium and having 8 years and never do it. They are all part of the same group. Difference, the same people. So today, if they come to you and come and tell you stories about all the fights they fought against education, and now come and tell you, say, they all of a sudden believe in the thing they fought against and say they will never invest in the judgment is yours. They can't be trusted. They cannot be trusted. We cannot believe them under any circumstance. At the end of 2008, Omampeni Kufoni MPP are buying based on NDC phone training control the buy NT. Ya two about TI, at the end of 2008, not national health insurance can't afford to do a wasso. Answer Omampeni Kufoni connect 12.5 million. 12.5 million. Ghana phone Bakumako 12.5 million. In an Omukra national health insurance card or medical hospital. It tells you how important this policy and program is to the people of Ghana. Unfortunately, by the time I am on promising a one-time premium, I am a two about 8 years. I buy now or the other buy another will be mono. By the time I almost in 2016, 8 years one-time premium no more bed dada NT and made 2 buying they don't buy no. They didn't do it. 2 no more into 12.5 million no. Now membership no reduce it from 12.5 million to 11.3 million. Almost 1 million. And now a free health insurance because now health insurance already no. Obekaya news na medicine no. 2013 it was completely dead. Card in the ukra by the hospital useless. Now I can tell you and I'm pleased to announce to all of us say and they am say the confidence level in the national health insurance no. It cost 17.5 million. In Tusha, you have a at 11 million. Next year, they almost about 6.2 million. And they are back home. It's Ghana for 6 million. And it's GDA. The current health insurance system, and it's Omakoji Kada, so the difference between the NDC and the MPP when it comes to healthcare access, creating healthcare access, creating the space for the Ghanaian person to access healthcare, no, clear. Yen ananom any woman ananom share in 2003 no. Yes ye twa ene yasefo kofuasefo ne omo so masefo be share no. Difference no eni yasan etwa. This is our scorecard when it comes to the national health insurance scheme. Ghana for the do omampeni kufo ejaye 12.5 billion okono na omateso about 11.03. Yabaye no enuma ya ye name and let me put it on record. Enye niyama ye pese ye about health insurance nyina na yetu ye. Still there are teething challenges and teething difficulties. I can tell you that. But still, in spite of all the difficulties and challenges with the delivery, any acquire Yama health insurance card, no more than a caution. And you're very clear. The confidence level that the Ghanaian person has in the MPP's health insurance versus the MDC's health insurance, no, obvious. And then somebody kaya, and I'll play a video shortly. I'll play a video for us to see how Ansana MPP are buying second into card now expire at once. They say we'll come back to cash and carry because it was going to take you about 3 weeks as a way to renew health insurance card. In Komobi, how would you need anything? As someone in the you are very much aware, say, San komodie no ni die enye. Everybody knew say before 2017 now ko renew health insurance card a manual obako di line tin by one friend saying 2, 3, 4 hours now to all say productive economic hours and so what to renew card and no 3 weeks and so card na dey on saka and instant digital short code.
The scheme was introduced 10 years ago and there are now more than 10 million subscribers. It means access to free healthcare and medicines for those most in need. Vida Shewudiaso is waiting for her child to see the doctor at the country's largest hospital, Kolebu. She's been using the National Health Insurance Scheme for 7 years. She says it's been of real benefit, but is not efficient.
At times you can get here at 8 a.m. and then you have to go to the insurance desk, fill out forms. All these waste time, and sometimes
it's being compounded by Ghana's deteriorating economic situation. The government hasn't paid its bills to those providing the service. This is one of the busiest pharmacies in Accra since the beginning of the year. It's a similar story for this private clinic in Tema, just outside the capital, Accra. The medical director says he's struggling, but he continues to see health insurance patients because he doesn't want to abandon them.
It's very difficult for us financially because the last payment was about some 5 months ago and we haven't paid our salaries. We have a lot of interest to pay in banks.
The boss of the National Health Insurance Authority says the government is committed to paying those providing the service, but that the scheme was too ambitious to start with.
For a challenging one because our benefit package appears to be quite huge, covering 5% of disease burden in the country. Perhaps in hindsight, we could have begun with a more modest benefit package and increasing this package as we got along.
The scheme is financed by a national insurance tax of 2.5%, plus an annual flat membership fee of around $6. It's won international recognition for bringing free healthcare to millions. However, critics argue it's not sustainable and that it's hard to see how the service can remain viable unless people pay more. Amma Boateng, Al Jazeera, Accra, Ghana.
The National Health Insurance Authority introduced the biometric registration to effectively link facility attendants to claim management and also deal with the duplication of card holders in the subscriber database. Since the beginning of the biometric registration in the Northern Regional Capital, Tabale, over 2,000 clients have received an instant ID card. Women and lactating mothers during their visit. Some subscribers say they had to queue for days and longer hours to be able to access the service due to frequent disruption in internet connectivity.
It hasn't been easy because I came here as early as 7 a.m. and I'm still in the line.
Tabali, and this is the health insurance situation. Very good. Ebusafo enyame ena meka enyame ena medema no eka saa nsem we. This is a video that was done years before MPP yeba bemu biemu in 2017, and that was the health insurance situation. That was the situation. That was the situation. Enti se yeka apomode ho nsemo a ense mama nyina ye clear say they are praying nyina ne tintini ne titia e apomode. And if you get that wrong, almost everything would go wrong, and we need to protect it. And health insurance no entwoma dwemba bibi so yare dodo na health insurance shase na me fa say on the policy a ehwe from 2016 and this is from yare ba akokra meka ho na che say yare dodo na o yare do a say yare bi wo na health insurance ro kwa enkoba ne ade ntie so we de enka ho no for 8 years they did not introduce even one additional illness to it. Nti the member to yana mutina ho anti ya wi ahodo na ke say ye ko eri na epia baso nkakra and then look say under this government you cover 95% of diseases in this country. 95%. About 95% of diseases in the country is covered by the National Health Insurance. Now, Mr. Mo, and then you the kidney abeka ho, and then you the childhood cancer abeka ho, leukemia, worms tumor, sickle cell you so mu a drobi. You the man kolana sen kolana wo de dro no mo a etumi bua na yare no nya seasons ni ade edidi ma me hwehwe di na me mbona nyina hu. What's the name of this hydroxy urea? Let me share one for me. Hydroxy urea. See the deal. We doctor for the better here. Hydroxy urea, and this hydroxy urea is very crucial and critical. Because say you told me the man and Quran all this, but we never did. And then Yamincha de Yamia Roma. A binder moto Abama 2017. It was your four. Only money you play and I say into Abama moon 0 month for the young come. And they the kidney in Kola were below 18 years. And in Pennyfoy war above 60 years. Moya aware to say Ghana ha in Kola 18 years and then the draw super. They are covered under the National Health Insurance. And the dialysis near they are covered. Cancer in Kolei, everybody. In fact, better more pictures, images kakra. Mr. Yamu images we know, kakra. In see, mo fancheme. But mommy yasha sa images si kakra. Nientias ye pa what it means for these people who can now have access healthcare under the health insurance scheme. Nti wo hwe enkolai ni yare sronku yi a se oyeni ba ewo ekrasi baby na akolai yare but omo science screen pictures ni biom akolai yare se ne ba enye ne photo true no photo of his ne ba ewo sa yare bi na health insurance enkoba. What is this parent going to do? What are people like this going to do? What are parents like this going to do? Citizens of this country who find themselves in this situation, what would they be doing? It must influence our decision in voting. Because about one room, and yet one sending panel by cancer natural bush of war. And yet one say Kotuaba, then the panel say, we no kaso be 10 win to me enti win to me enti mo fama me na we no unya ho kwan say oba be ye no wo di zero na ba ye ono win to me ye ni nyina wo ba o the 1 2 3 4 na ba be ka ho na say ko be ye 10 untumi ye 10 ye no kre ba wa ye 4 wo ye 0 enti men ben kan che say win to me ye 10 enti fama ye che say o ye 4 ba wo ye 6 or ye 5 ba wo ye 7. That is what should lead this conversation. Anything did you? Enya kasa basa basa ni ntietie mo name kasa ntwi name penifo ye kasa mo nim debe. Ye purely based on the facts. Yes say enye no what health insurance wo nya na etumi ye. Ne mum si ye hwe health insurance in common dia nipa do ya form atoso health insurance me no kasa there are some hospitals kra aban sika is here the common mo nya nkoye edile kakra ebi akechi. It's true, it's there. But yeah, improving no. And my confidence that hospitals in the scheme no a cost row. Until one of the days to say I'm share 2013 Al Jazeera video yeah and confess I'm hospital NG and our quiet line 3 weeks and so began the card no. And then confidence in the cost row into hospitals no or J card no share. There are companies and first use private health insurance schemes and they it's at the confidence level in health insurance and use Ghana health insurance in the mom workers. It's in case everybody now because there are hospitals a bicycle say there are those challenges. But the hospital didn't say And by the way, I improve this system to the extent say obey to deliver service because government is surely going to bring them the resources. And see, and NDC for bar bemuno or mampeni kufo jano 12.5 or what so called 11.3 because we share video here. People are tired, they are stressed. Say me buy renew card, now me did 3 weeks there, and then me continue. And a card no to me the hospital. That's a year in JDR. Then what am I going to do? Until they started dropping the health insurance card and living their life in the hands of God. And until the man numbers and then you buy based on the confidence in 6 million. Ghana from Akumako 6 million. Data doesn't lie. 6 million. And our confidence from more health insurance in the cost room to abedom. Adentia, Niamani Bene say, Yaria Bubua. Health insurance in the Kobano. Yeah, the beer back come and this is for the young come. And see, of course, if there are 6 million people who feel say there are diseases that they would need cover for, this is a government that cares for you. In spite of difficulties, in spite of challenges, it's a government that wants to be there for you. A government that acknowledges that we have difficulties, but I want to be care for you. I'm telling you, I want to be there for you because I know we have difficulties, but I want to be there for you at a point of need. Private health insurance schemes, no. Private health insurance now, private companies they don't cover these sicknesses and these diseases. But your government, the government you voted for to come to office in 2017, no, has brought this. Now, this person that was keeping people 3 weeks before they can get their card with you. Under the end, you are not perfume now card I want to go hospital. It's all 3 weeks. Now 3 weeks you don't know card on for so also. And then instant. That is a big difference. Under the NDC, Oman fa ya rest for bia me card you beto from Oman peninku for hono. And then you the kidney abeka ho, you the childhood cancers are you I ba one show between us was in our she with Japadina, you never become. And see, and the numbers now, Ghana for the Omodom health insurance, Ababeka. And this is our scorecard for health financing in this country. If we are a big conversation, health infrastructure. We provide health care near the we provide finance near the at the biggest question is health infrastructure. And if I say yare boa obeko, and if I obako pay ayarisa, and so extremely important. But maybe a fee video be very, very important. A total be a okasana wa okawasema as a wa next chapter yentu yehu ye data and the facts and kwanekasa. Mama Ghana no AD health insurance here babeto ye no wa dance. Yen hwe no kranse ya to nkomodie no so.
No me de me ba no hospital. O yale esada ha ya. Me kwa mi se me kwa kotu ya card me ya so de ma renew ne health insurance no. Me kwa ya no na Ghana ji o so de buy me see an. O ji o hwe so se akola no ofie se me so 4 years. O se abe ya adwuma sisi ya. Kwa a ya adwuma me ntia henda Ghana no. Etu omo ya ba o mi abeba. Omo ya ba o mi abeba. Yeah. Oh yeah ba o mi abeba.
Enti o hwe mami ya ono kanasem efa your health insurance we are one dance die no. So from 2030 dance die no. Now 2024 dance die no. Yentoba for progress. Yentoba for future. Yentoba mother time amudu ba mia. Na onfa ensakraya sonko a ebema Ghana for ho atomo embra. Penny die. Yankasa we penny papa there is a ho chene o hawo mawo. But the difference between a good leader and a bad leader, they say, Bako, I want to know the Sako Vium, me a dead goat, me a dream funu, means you be a Diamokana Mibiti, the Ampibia Moyami and family. Kendi Papano, on a Diamocha bar, or can't any penny in a room, a boy in ano, no say, or how na ba, a manuna ba, a hand me to me a gumuka kramayin, ye to me a queenum, once we pursue the challenges and make sure that we fix them. A good leader is not the absence of difficulties and challenges. A good leader is a leader who, in the midst of challenges and difficulties, has the courage to mobilize the people and drive us out of these challenges into the path of prosperity. That is what Dr. Mahmoud Bawumia represents. That is who Dr. Mahmoud Bawumia is. And that is why confidently we are saying, let's vote for Dr. Mahmoud Bawumia for the sake of the future of this country. Health infrastructure. The records of the MPP government when it comes to health infrastructure, MPP 1, MPP 2, are unparalleled and without doubt. And I'll tell you why. MPP are buying we yes scorecard in here when it comes to health infrastructure. Yes, scorecard in here from 2017 to 2024. This is our scorecard. Number of hospitals, 12. Chiefs compound, 1,737. And you know, say Ghana ha, health center, 5. Polyclinics, 15. When you say Ghana ha, health system, no, yashishe. At the basic level, at the electoral area level, is the CHIPS compounds. Ehono, ena se uti paewo, uyuma kakra, uhodo, ubi mekana abeko. Uko do wana se ebro CHIPS compound for nuswa, na yede uko health center. Uko do health center for nuswa na ebro muswa, na yede uko clinic. Uko do clinic na ebro clinic for nuswa, ni yede uko polyclinic. Uko do polyclinic, not polyclinic for soon to me handler near the district hospital. From the district hospital and far near the regional hospital. From the regional hospital and far now for the tertiary hospitals to say the number one most important and crucial health health facility in here Ghana Media and the CHIPS because the first point of call. And so it's very important. This government has really focused on it. In fact, a lot of even government institutions, government enterprises, almost social responsibilities, they are pushing it into providing some of these compounds and health facilities across the country. District assemblies are building it. In fact, National Electricity Authority, they are always building health facilities at the CHIPS level, at the electoral area level, from the GMPC Foundation, Ghana Gas, to say several of these state institutions, National Health Insurance and Kasakra supported districts to build some of these CHIPS compounds, and this government has built a lot of 1,737 of them. Okay, can projects are by we are within the health infrastructure space 2,043. This is our scorecard. In fact, agenda 111, and I will go into the agenda 111 especially very soon. And see, we are very confident about what it is that we are doing as a government. Without any doubt, we are very, very confident about what we are doing as a government. And that is why, you see, based on the IIA, and based on your scorecard, these are some of the projects several of them in so-called hospital. And you see, there are some of the projects I've been in NDC for say complete fabrications. Plenty of them are complete lies. And I'll tell you, President Kufuor in the year 2008, I share projects or share the Eurojet projects. I say, you say, Eurojet. And I'll tell you something this evening. President Kufuor, somewhere in November 2008, a share Eurojet project. I say, now the Eurojet project, basically all it was doing is to ensure, say, certain health facilities will be provided across the country. Certain health facilities will be provided across the country. NDC for buy, NDC for buyer is also a project. For the 8 years that NDC remained in power, between friend is saying 2009 up to 2016, almost their project in Eguho, Emma Kofuasefo, Yansu sign buyer, Yansu sign buyer, Ebe project. And it's quite painful and quite sad. Say, in spite of all of these things, you still hear them. Still, I bet some more kasa baby, cancer markesi baby, and these are projects that they should have finished in 8 years. At some point, in Bono, Sika Mokoji, some of these projects, almost diverted Sikano, and the Sikano election, friend is saying research, and we'll come to that. That is the kind of people we have to deal with. And today, these same people will come and talk plenty. Yes, every government provides some infrastructural intervention. But I can tell you without doubt, say, what this government has done, it's way more than what the NDC government did. And I've actually shown a lot of these things in the table that I showed you. It is important, say, on my say, who provided health delivery amount my you pay attention to two critical things: the financing part of it, and then the infrastructure part of it. You see, we fix it financing, no? Now we fix it health and so. We fix it financing, no? Now we fix it health and so. And it's important that we keep our eye on these things. And we believe that as a government, we believe that based on all we have done and based on all we have tried to put in place for health infrastructure, no, we have every reason, absolutely every reason to believe, say, this government should continue to finish what it is that we have started. We should continue to finish what it is that we have started. And these are some of the pictures of hospitals. Abaye ya intervenia it me provided for us across the country. Infectious disease center Cape Coast, Keita Hospital. Obekaya, a lot of these facilities. There's a East District Hospital. There's a polyclinic at Segi. Polyclinics, we have about 10 or so of them scattered all over Greater Accra. This is the Unauthorized Hospital, and also is there. This is the Buipe one that I was referring to. And several of these interventions have been put in place to ensure, say, empro, say, who touch ma and now who can say what munko be say what the enemy, munko be say what the enemy, say what it didn't say what where konongo or say what. Look at the Sewa Hospital. They want for anything. An amazing edifice. This is a project that you can see in 8 years. 8 years, now come over being some you. They didn't touch it. They left it. Kufuase for, and a sign koyan by an sign be sa sign be this media. And this tells you the caliber of people that we have to deal with. Like I said, on the next chapter, for us here, it's just the fact and nothing else. And so once we put the facts out there, it is up to you to take a decision where you want to go. Here, GD said we should move towards the future, and the future is Dr. Mahmoud Bawumia. In 2004, and this is a very, 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 very worrying situation. Mobekai May 9th disaster. May 9th disaster, just as it happened in under COVID, when we realized that we had over 88 district hospitals, only a friend is in hospitals. May 9th disaster here in 2001. That was when this country realized that we had an extremely poor emergency system. Emergency systems, you will say, at home, it doesn't even exist. In fact, we did not have any emergency system at the time. Until the year 2004, and now Oman Peninkufor Eshasi, and again MPP. The same MPP government had to come and put in an intervention. And in 2004, the National Ambulance Service piloted operations with about 69 newly trained emergency medical technicians. In fact, that was the time and we're trying to put in place a completely new system to ensure, say, Ghana, you benya emergency system to me, and Oman Peninkufor piloted this with about 69 newly trained emergency medical technicians, 9 ambulance. As of 2017, MPP about not Ghana, we had only 55 semi-functioning ambulances. Not to say, the ambulance Bakumako 55, but some ambulance 55 for the Crampono, and then and yet 55 years. We got worried. And now Don Akufo-Addo realized that, hey, we cannot continue like this. So throughout his campaign, in 2016, he started talking about ensuring that we provide this emergency, we put in place a solid emergency system for the country. And that is why on 28th January 2019, Nana Akufo-Addo commissioned 307 new ambulances. One constituency, one ambulance. Say, I'm yes, she crampono. Ne pape muno and kasi said boss of sensa. But 55 at the 9 year demand crowd alabraka. I'm yes, she crampono. Constituency biano. I say, ambulance bako. Now I feel bigger facilities to say, Kolebunia diano. Yenya ambulance and every into 307 ambulances and on Mampeni and Nana Akufo-Addo introduced in 2017. In fact, say o calculate now we share the number of ambulances of Mampeni Akufo introduced here. Now we share the biane. Now we imagine say it took the same MPP. So Mampeni Akufo the started the ambulance service for the record. As a matter of fact, Ghana National Ambulance Service of the Republic of Ghana was started in 2004 by the MPP government. For 8 years that the NDC were in power, they did nothing to improve on the ambulance service. It has taken the same MPP government to come back 8 years later, and then in 2019, come and continue what Mampeni Akufo started. That is why, and maybe I may catch him and say, let's allow the MPP to finish what we start. Because if we had continued from where Akufo left off in 2009, and Kabila Assembly in Kewabé 1,000 ambulances, because it had to take us to come back 8 years later before we could put these ambulance services together.
Each of the 275 constituencies is expected to receive an ambulance by June this year.
The health delivery system will be significantly strengthened by the expected arrival in June of 275 ambulances, i.e. one per constituency, to make treatment in emergency cases more effective.
President Akufo-Addo says each of the 275 constituencies is expected to receive an ambulance by June this year.
The health delivery system will be significantly strengthened by the expected arrival in June of 275 ambulances, i.e. one per constituency, to make treatment in emergency cases more effective.
How do any bosses from Con and the mine? No crepa and say, with the bosses. Never in the history of this country have we had any government, apart from the MPP government. Think about the emergency services of this country like we have. Imagine in the middle of the night at 2 a.m., 3 a.m. Now when you're emergency, now we need ambulance or district in the name. Then put ambulance or a hospital be there. Now we pay mwa see a befoul. Yeah, what 1 year? But you say, as some of me came, the way chichi now would be instrumental. See a share numbers, no. Near showing part of the ambulance service about from 2019, Bepemone, Afibia Eboa, it will tell you what we were missing for 8 years, the gap we created in 8 years. Gap we created 8 years, and I am my MPP Abayan to us. Every ambulance service, it will tell you the impact. The number of people who lost their lives, the number of people who could not get access to emergency services because we didn't have ambulance systems, proper ambulance systems in this country. Districts do not have. The whole region, region in ambulances, 2 and 3, is the regional headquarters. That is how bad the situation was for us as a country. In fact, within NDC 8 years now, we attempt to say, we provided some form of mobile emergency support. Don't go for any. Kai, I see we, and you be a win musha. But this is what they did. They didn't fix the emergency health system. Rather, what they decided to do was to introduce a mobile clinic that cannot function. This is what they did. Meaning, say we out in the room, we were man temuda, and I will put them room say NDC for car we or what Eddie and Webby Ebreoda. But this is what it is that the NDC did when we gave them the opportunity. Take a screenshot we na print it, na fashe frame, na for board demo. Okotoba 7 December, my wing Kyle. Na Kai say, and yen woman in Nina and ye yet to me, Nemu, Seka wing quadia. And then for 8 years, we had to endure. If we had that statistics, we would have realized what we missed for 8 years. 28,000 every year. What would be the fate of these people but for the emergency services that President Akufo introduced? Now this is it. This is it. 2009 to 2016. NDC are buying, we increase stations from 128 to 130. That is 8 years. 8 years are on the 2 centers in account. 2 centers. 2 centers. Normally count. MPP. You're moving from 130 to 275. You're there about 145 new ambulance centers, new emergency centers, and our Ghana emergency services and all. Between 2004 and 2016, if you have President Kofoni MPP are buying share National Ambulance Service, I say, 2016 and NDC are buying air free so now the total number of ambulances and you can semi-functional as a one who be near 55. Amak Danko Akufo-Addo Daroma, MPP Abaya Daroma, and as a country we boast of 307 ambulance services, and that is why 28,000 minimum every year are able to get emergency services when they need it in the middle of the night, daytime, in the morning, in fire, rainstorm, to ensure say lives are saved and lives are protected. Responses. Now, in fact, every year, of course, because you are 55 semi-functional, you can only respond to 5,000 people a year. But you can imagine the number of people who needed help. Today, because we have 307 and more, no, 28,000 Afibia are responding. And no ama Ghana meno kasei. Now your ambulance population ratio, one ambulance, a funny part 524,000. One thing you am patch of a pen. Ghana, as of 2016. na nipa 524,000 nipa 500,000 obi a ambulance back 500,000 obi a ambulance back but one thing you assign 500,000 no be a ambulance back and then yateso nipa 84,000 and a use ambulance back you go so quick. In fact, the global standard ne say nipa 25,000 ebe ya e use ambulance back into ambulance back to nipa 25,000 and then yatiso from 524,000 over 400,000 reduction. You about 1 to 84,000. Dr. Mahmoud Bawumia say you better be aka ho or the dodo na aba beka ho or be shemukina na you to meet international standard no if you 1 to 84,000 no even below the 25,000. That is the next chapter of Ghana's emergency services. A son say a good year during the period means the number of employment are now 1,651. And so to the home about 178 people per any within the ambulance services. And then we can say with a revamped, resuscitated, revitalized ambulance service, you're increasing number of people here from 178 to 2,574. That is the scorecard for us when it comes to emergency services. Anajo a worker or bad time. You did not call Chiefs compound. You did not call health center. You call Jina war. Odu yano moja truna was shoti moja. Adia ba ko pet ni saka. Obenya yebetumi savino. And I say yebenya no kwa. Eno eye moja esese o nyane edisi so. And I do the swim 3 a.m. Physician assistant, nurse wo ho, oni moja, oni nyobeye from South community nim Echo District Hospital now regional hospital. Over 15 to 20 kilometers. Ne kwan ye enti on to me nko enti na waka. Dr. Mahmoud Bawumia ni MPP aban say David, we have to be creative. Si yen to me ye akwa nyina wie prekope. Ni yen to me nya niam ni nyina nya facilities amoja be wo Ghana electoral area bia prekope dia. Can we be creative? And that is the point I make all the time about having solutions in the midst of challenges. That, of course, as a country, we are unable to fix all our roads at a time. What it means is that it's difficult to transport people from certain areas in the middle of the night on time to get the needed emergency service. So what do? Do we just throw our hands in the air? You give up, Debbie. Yam pet coins from could be a bit to me a faso. Ah, yeah, you're quite so much you bet to me a show. And no, and a ma zip line a buy. Na mummy ntie abra Dr. Mahmoud Bawumia e bo zip line so e che Ghana for.
In terms of enhancing access to the delivery of public services, in another 3 weeks' time or less, 3 weeks' time, we will see medical delivery by drones begin in Ghana of critical medicine. Critical medicines and blood.
Zipline, I say, or a crabia say, baby, I will come over a one so be a ja, a quine room, to mean 2 quine 10 a swa. Say, health center or clinic or Chiefs compound and District Hospital be a year moja, near the Agio Binkwa and perfume. Now, make cram me fee a captain note. Tete kwashi e shoti moja na se ye nya moja na ye dia jibi panen kwa na se bi ni wa e se fa ambulance ni ye to ambulance ne ban kan ana se ye tu kokofodi ani akofo moja na ba minimum of 30 minutes there e be bi as ya be dun kan ye package wi as e dia ko until within 1 hour to 2 hours there ye be di as am fa ne se bi BAC ye kwa mu kra ye tuwe nya moja aba be si ni pa no so 2 hours until there are people who are definitely dying within that 2 hours because they couldn't wait for the blood. And no, and a zip line, a babedu mujuma. Until we need it, a bear for Quambia bar. Yedi mojano, ebesi anomano so broniano ma, drone, broniano ma, yedi besi so, na edi mojana bro will be a near their help. That is all zip line is about. se panie bi na ese ye de wo na ebi ni ho a ye mfa ka emfa nko bibi ankoje ofre ewo app obo app no na zipline for the drone ahye woni anoma nim drone na ede abesi opon ano pe na ede ahwe mo me he drone e deliver niema and they deliver ndro e deliver moja ema some communities but mo bo sa video de mame.
The introduction of the zipline medical delivery services, some of the communities in rural areas are now able to receive quality medical services in time. The introduction of zipline medical delivery has positively impacted the work of health professionals in the area.
The LMD will request every 3 months. So after they deliver, if you need another drug, you have to wait for the next 3 months before you get it. But when zipline was introduced, things have been very easy. When we are in shortage of drugs or medicine, we just request and within 30 minutes, we get them. But previously, we didn't get any drugs, so we normally refer them to.
Dianuna, bakukura mumbo video ya na nkole yi kwa kogu mumbo sa video de mami. Enkola no ekogu wa nurse for kwa kofa no mumbo sa video de mami. Na ekosi wa na chese ena besi wi. Ena dafi mi na nkole ya kwa kofa. Na omudi akoma efeni se nurse for na nurse for kwa kotam. In a day, for some hospitals, for some health centers, in a day, almost to make about 3 or 4 different deliveries. And there are no say zipline. You see, built 6 zipline distribution centers. You see, Bako Menako, Asante Mampong, Vopsi, Sejuri also, Enum, and Ketekrache. A beer to be delivered near within 110 kilometers. Then 110 kilometers, they do Mbao. Let's say baby I will be within that space in Biano. Enti e Ghana ha say na esi achiche mu no baby I will be able to deliver emergency health service aye ama me na o ka say o can supply distribution centers in Abumu a omo deliver 17 million for medical supplies to Ghanaians across 13 regions of Ghana. 17 million. It is only past 17 million. The biggest question is say yes zipline and I didn't grow command and yes zipline and I didn't moja command now and what would have happened to this 17 million on the medical bed. And so yedi adie muntie dia NDC for ekaye NDC hanabisu muntie wankasa for wasu tie dia hanabisu kaye when we were going to introduce the zipline medical drones.
If the drone that we all know, that I know that is what went and took the pictures of John Dramani Mahama. That has the cameras, and we have. And you are talking about women in the rural areas. Then it means that we have lots of roofless bathrooms. Last time, even in East Legon, I was shocked to find one by the hall where we launched our campaign. You know, for the by-election. And if a drone passes over any object, and the person controlling the drone with the remote behind a screen, whatever the person sees, the person feels like clicking. The person will click. Now, where is the privacy policy statement regarding this? You want to bring it into the country. You have taken people and some companies to court because once they were turning on the high seas, somebody's drone passing over them took their naked pictures. And so what I was saying that you use we women, I was addressing women. If that is it, now you should come out and give us your privacy. But if not, once I don't have it, once I'm not sure which drone is flying over me, I'll take it as the drones that also have cameras and they also fly and they take pictures. They may be going, it's a human being who is sitting behind the screen.
But you do know that not all drones have cameras. Like cameras are only mounted on the drones. So
no, it's not for me. No, it's not for me to think. It's for the authority that negotiated to tell tell us, and whether it even has it or not, you should have a privacy policy statement that accompanies it. So when it comes and violates my privacy as a woman, then I'll talk about it.
Aje Ghana for 17 million enkwa. Aje 17 million Ghanaians aje omunkwa. Na say women organizer of the NDC woka say drone no Ghana for mungu na the entire eba and say ebetwa emma ho ewe dwaria. I keep telling us Ghana for health insurance me boche mo omukuti free teachers omukuti aye. Anytime I better say NDC for complaining about BBI MPP abaye net say ade be Ghana for. It's as if they are on autopilot. I didn't buy a see a good class your dream. How can you sit on TV and say the medical drone here, you check Mrs. here, Ghana for 17 million and quano. That medical drone, no, you're about because you're the better man need to pictures. This is the first person and the people who are moving from your house to house telling you to vote for them. And the decision is going to be made on 7 December. You have a reason to vote right or vote otherwise. Now, wambwa adiena ye na ebwa Ghana for edge Ghana for nkwano. Ono to humpi ma ho eseno umentie the United States of America Vice President Okafa zipline na ye dia bo my we no. Muntie di okaye Kamala Harris umentie di okaye.
Right now,
Kamala Harris.
African nations are pioneering the delivery of healthcare supplies by drone. In Ghana, this service has delivered more than 9 million vaccines, including those for COVID-19.
Almighty United States of America Vice President Ebo Ghana baso say ade na ye no kra wiase afa na nyina no ye no ene amai kakra bi na ye di animu ye de gini pankwa NDC for Ghana say ye de hwe ma ho twa ma pictures zipline omo offices ni bi o mena ko office ni se hwe so die ni vopsi die ni tie NDC MP or say NDC MP prefers motorbikes to drones for medical supply into or say yare boy I match 3 now pemuja to moto 50 baby awono na ride 15-20 kilometers na kohwe sempo muja wo ho a asa wajibi ayi den aba omo solution no nti yeye solution is say wo pemuja o anti-snake venom o pe emergency medical supply na bi ni baby awona ye the drone ebe shooty abroad in real time na dey ahwe alternative na waba ho say to obama ne say on pen yento motorbike motorbike no. So you have a choice. You have a choice to vote for drones that will deliver medical supplies for you in time of need, or you vote for the NDC for motorbikes to supply a friend is saying medical need to you. South Dai NDC MP Roxanne Dafiamepo. South Dai NDC MP Roxanne Dafiamepo. The new Musemdi Roxanne Dafiamepo say ono ni solution a ono ni party omo de ba and say yemfa motorbike mumbra na nye drones we say yan kasa tenten like I said next chapter yen kasa nti obia yen kasa ye career he until you have a choice to choose to make between motorbike and drone, and I'm very sure say the millions of Ghanaians watching us this evening will definitely choose zipline drone medical supply system than a motorbike, because motorbike tete adwen tete nhyehyeye etwom enei efasobia entumi eniso when you compare to drones. So we need a drone option now and we use motorbike, but so we to be gain kind quick far gain kese. You can think big now, you believe in possibilities there, then you can believe say drones are way better than motorbikes, and that's what we are proposing to you. UK's first medical drone delivery project will change future of national health scheme. September 8, 2022, United Kingdom, UK, your colonial masters. No? UK's first medical drone delivery project will change future of NHS. September 2022. Dear no. Ya real crown. I feel a United Kingdom for cry eba baby. That is what Dr. Mahmoud Bawumia is proposing for the next chapter of the development of this country. Possibilities. Think big. Things that the NDC think is impossible, those are the things that the MPP believe it's possible. And those are the things we fight for. And then, Ghana, today, dialysis, Aba yetuya ekane da kolebu, anama omuntu provide dialysis support no. Ye free ho. Parliament I approve 6.87 billion for national health insurance yɛn fa hwɛ dialysis na yɛn fa mboa na Ghana phone to binya dialysis support when it comes to those who have kidney, and we are all aware say on my way mu and say ade aba pa ne say what WhatsApp group we and say the flyer bia betum you say obi na wunim na hu na che be hwe na na da betum me ankasa me nua ba me ankasa me cousin kidney ekuno, and there are millions of people are kidney area how e board thing and one thing onto me in Tinkoko hospital no e dialysis na go be to me atena se ache but when ya m1 in them I don't know why when ya e be to me ahye usika gina kra because idea na what bia esese wo ye why when you be to me ahye e be hye kra enti aban have to intervene. God being so good nyame ncha de aban na ohaw mu kra no still a opekwan obefa so de beboa ne manfo no MPP aban. We have come through for the people of Ghana again. We have difficulties. We have challenges. Of course, that's the like inflation, I'm sure. You go so I preserve film. Exchange rates, you go so I preserve film. And see, difficulties were, but in the midst of the difficulties, MPP is coming through for the needy. It's coming through for its citizens and the people of Ghana. That is the biggest difference between us and the opposition. That is what makes us different. We may have video you can say my data and statistics and so. Mo family ehwe videos bi wo na e hadwen mesra mo fa nchen ye kapo mu de hu sa mo hwe video yi mame.
The humming sound of medical equipment here at the renal units of the Cape Coast Teaching Hospital welcoming patients. It's a Tuesday morning and 15-year-old Priscilla Santi is being wheeled into the renal unit here.
The doctors told me I have to be on the machine, and I have to be on that machine either twice or thrice a week.
And see, based on how he and if I will cry, they are back on Lebu, back on Fanoche, NET teaching hospitals. The Brina Kashi Shefiu, the Brina Kashi Demo, because on no cocoa to say, Obitia 3,200. Now what should be now ordinary ration home. People are dying because they cannot afford. People are dying because they don't have the money. But today things have changed. Abai Edin Sakayaba. Momenti announcement.
Vice President Dr. Mahmoud Bawumia has announced that the National Health Insurance Scheme will soon cover dialysis cases, bringing relief to many Ghanaians who struggle to afford their costly treatment. Dr. Bawumia made this statement during his campaign tour of the Upper East region, where he addressed various gatherings and interacted with the locals.
I thought it was very important to deal with the burden of sickle cell sufferers, and that is now covered. The same thing with childhood cancer. And childhood cancer is now also covered under the NHIS. One of the things that we are now starting to do, and the ministry, the National Health Insurance Authority is releasing some money for this, is to look at dialysis patients, because we are seeing a lot of kidney problems that are in there for a lot of our citizens across the country. And so what we are aiming to do is to bring dialysis treatment under the NHIS, just like we've done for hydroxyurea for sickle cell sufferers and also the childhood cancer. Now,
based on how we in our buying Debbie, we are all trying to get ourselves from the global economic challenge, but we have to be there for our people. You have to be international, your man for whom you say, whilst and they are losing their lives simply because they say Chaba. So we intervene. And Ghana buying say unya kidney now we are below 18 years. Wo kidney dialysis obey ni nyina bosumi ni nyina no ebetua obey ni free untua hwe. Temesrew se wo fie e free e chanopa for obanoko onko dialysis. Obetimi atena se ache. No so contribute to the economy of this country. Ebium say with the 60 years and above on so with the 60 years and above on so kwa ebe show free untu ya hwe nempo Mom within 18 to 59 years, Uncle Confanoche, whole teaching hospital, Tamale teaching hospital, if you Quanta hospital, 2 sessions, free. 2 sessions for you for a month, free. Timmy and foul kidney nation. What buy no? Abem. Edin she abe to akwa mu ama say ese otumiko na okoje ayaresa. Na afi umam kokolebu enso no 50% of mo sessions na mo per month no so abaya fa ho ketua ma mo. Ese wachemu kana nka bebobu emumienu na mafafa no mutua ma. This is what a concerned government does for his people. This is what a willing government does for his people. It's difficult today in the world. Things are hard. Things are very difficult. No doubt about that. Every country is struggling to get back and trying hard to get back onto its feet. Pre-COVID days. But this government is saying that whilst we are working at all the other things, it's only 3,000 or the dialysis. Inti abaya for honka utuya ede amaye. Abaya asanswa ye urology and nephrology center of excellence and also eboa na ashena kidi yawe edi huduma. Na menka semi so chewo. Yeah, digitization. And yeah, abstract. And yeah, be your own frame. Mokai and run out your course and your fill forms. Now, fill form ya more card. Your more card and your creative folder amount. Inti enei oko efie ekwa yie ewo krom. Okodu ye no e na woyem ka wo. Okodu hospital. Instead of say you be me do ni ahwe ni awo wo pane no. Udu a afa ne yese ko fill form. O fill form ya ko yi card amount na yakoye folder asa ube wi na bebre kra ha kra say okodu hospital watena sia ma next fashion ama na ewu eni aban eye free ho into district hospitals, regional hospitals, teaching hospitals aban epia akọ akakra aban epia akọ chips compound dia aban nyina ne say nei ukọ hospital a e-health system no dia eye nyina ne say ote kasapin na wo ko hospital kasapin na wo ya card wo ho ne de wo ko system ni mu a enu ano no se wo be piem e wo keta na se yare bo na wo ko hospital a de hia ne se wo be yi Uganda card e bo Uganda card na wo information nyina e be pie I mean ka se ni nchamo what is ankomo ni bi da se obi enya accident na de bi hospital no wa short moja na say man moja so na why unconscious ontumi nkasa watomum na ye nim ne blood type ye nim ne blood group na afa ne ye baba twene yakota se mo nim saade no and I can tell you say with the e-health system no a year free ho enti bia wo fi da mongu no ne ye hwe ne ye bo we information na the bas system nim e wo twifu praso even though wo nko hoda udin onfe blood group yare a wo ho endu a wutumi num endu a wuntumi num allergies a wo ho bibia wa yare sa hu se wo BP wo akoma yare wo ho umoja mroso ni nyina be show e wo twife praso se de be ya sempo wato mum anade atowo so a yen ka se ye twe wo no wasori anse ye hu edu ede be mawo straight away ye be hu edu ede be mawo ye be hu ekwa ye be fa so ye be kra na ya hwe. That is what the e-health system does. The e-health system, bibia obe fa wa Ghana half and nyina no. We information wo. Na nekura Dr. Mahmoud Bawumia de registration at birth abeka on kwa dey fekeke. Because don't forget say you synchronize Ghana card with National Health Insurance card. You synchronize Ghana card with Senate card. You synchronize Ghana card with your tax identification number. Yeah, synchronization in wie. It's a group the core system no. And we hear say we watch doctor biam hospital bia be call Ghana ha nyina no doctor no onye hu wo je Ghana card number obehu blood group no information na we hu ko be fa so be den obehwe ewie no doctor ba omi asan the e-pharmacy so ba ene e-pharmacy adawoma uti wudem na wa to eduru ne ye deliver eduru na eden ama e wo fie ebusafo so wo to wo ase na o keka ne ma ebu mu a na obehu insonson so pa Dr. Mahmoud Bawumia na dan kwakufa ne MPP aban ede aba Niama ne de bebre na aka ye ntumi ye dodo na aka ho nsam enyensiye ne mu se wo kari na wo we na wo hwa obemu se de aye ne dross wa ese ye bom ban na yetumi make sure say eno agire yie was to pursue the outstanding one. And the impact of e-health going paperless and paperless or quite often our quiet food and card in your improve efficiency. And the men no cost our hospitals here from health everywhere waiting time no and no so queues no and what ama clinical research because your information data bebre you bet to be Uganda and nipa do omunya malaria last month nipa do nya fever nipa do say nya say all at the same time because it's connected across the country and reducing rejection of claims by the National Health Insurance because first yes in the hospitals be ye kunulu ebi mu ye ketashi senti omo de no kwa health insurance they are not check debi and because of the e-health nti obi ehu obi ade de ni bi untumi ye bibi amfa chiri nti aba eno so eboa na health finance eno so akọ entem afa aboa ema doctor for nurse for nyama pepe when it comes to protocols there's so many save life like I said sadia tomi so the back hospital that's a doctor no oni me blood group that's a miyamoja just otono boase no abehye nyama enei onya bo me information na me details ni aba nti time na nka first obe waste no da hwehwe nyama ni ndan so wabehwe me no eni eswate obetumi ahwe me ententem and after so no and this is a very important point track some core parameters which benefit our people like availability of empty bed into a esanisa e-health stability hospitals are connected and to doctor no all show now only say me refer ko St Joseph no system nim onim pado do e wo St Joseph onim hospital e wo mpa any hospital e nim mpa onim hospital e wo brewe any hospital e any brewe onim hospital e wo specialist way any hospital e any specialist way and that is the next chapter of Ghana's development. Dr. Mahmoud Bawumia say we need to finish this. This has to get to the church compound level. O church compound na wo community dem no. O church compound na wo ukromu ho no. O church compound na wo ekradase ho no. Ese sa church compound no so beka in-health system nim na etumi nya no prakope. We cannot truncate this progress. We cannot go back. We must finish this. And that is why we need to vote for Dr. Mahmoud Bawumia come December 7th, 2024. There was special interventions bebria ban yibaye odiaba. Akufo-addo aban. Several critical interventions. The notable pa University of Ghana Medical Center phase 2. Yeba ben na Professor Mills ashase University of Ghana Medical Center. But obaye no oye 1 pe oye phase 1. In fact phase 1 no omampenda na John Mahama betoye nti obaye no so betoa so. Ono kwa wenwie nti omampeni Akufo-addo so baaya no wan to antwene say Atamils de shase na Mahama beto aso nti oto atwene na danko Akufo-addo ewie phase 1 no prekope owie no amana nso wa o make sure say or the phase 2 no of the University of Ghana Medical Center no be dey ebeka ho nti no ko University of Ghana ya ye phase 1 no ya bewie na ya sans wa shase from phase 2 Akufo-addo yobia anko on fa University of Ghana phase 2 ni see University of Ghana but on fa politics ending in Mkai. You could have taken that project to anywhere else, but to this University of Ghana campus war, just to ensure say University of Ghana Medical Center no betre. I enhance it in training of medical professionals. Now a center of excellence for our health facility. And all kama almost contributing strongly to your medical tourism on my way. And again, also your second phase of University of Ghana, University of Health and Allied Sciences. And what these things are doing is these facilities, training of doctors, any other health, allied health professionals, and abai also introduce training of specialists. And what this training of specialists say, one shortage in the specialist healthcare space, my way, na adie bakwa denese. Specialists be a training no my win biano. MPP aban ayen free. Until all these specialists are being trained for free. We may have video quickly on University of Ghana Medical Center. a phase 1 no before the buy the and a phase 2 no or phase 2 no ebeka ho where your University of Health and Allied Sciences are na na dan koku for the phase 2 abeka ho a and no it provided the critical training for your health professionals ewo on my way mu na we have projects here abanwe atamasi ho na wasan ahyemu kena na ebwa we need to finish this. Let the MPP finish this. There are difficulties, there are challenges, but let the MPP finish this. Yaya we nyinai omampeni hukeni your first lady Mrs. Rebecca Akufo-Addo na ono so nam na obwa ode na hoden ta aban ni nuku echi eye no ma hodo bebre ewo ye apomode ehonsem. And through various initiatives and advocacies, we championed maternal and child health, improved access to medical services, supported healthcare infrastructure development, significantly we contributed to the overall well-being of Ghanaians when it comes to the healthcare. Madam Rebecca Akufo-Addo, the leadership when it comes to mobilizing resources, me municipal chief executive wake up, and you can see cancer running through all the efforts that the MPP government, because it's expensive to manage. And if government doesn't support them, it will be difficult for them. The First Lady has built the Sunshine Hostel to accommodate children receiving cancer treatment. Any of my busia for Moka Hospital, baby, Nyashebu, Kwame Num, Adankrebi, Biampa, Meme constituency Kra, Ebi Esiwa, Rebecca Akufo-Addo, Sunshine House. This is what the First Lady has been doing in the health sector to support the cabinet. Wabra on my way, I found into my pay fra. I just see Kwampaso, I nama yet to say Yeniagia. In fact, 2019 is said to be one of the happiest Decembers we ever saw in this country so many years before then. Then all of a sudden, out of nowhere, you were somewhere in February, March, you say your body be a friend of COVID. Nobody knew what COVID was. You need to be crying for your team. But Ghana was adjudged one of the best countries, one of the countries that best managed the COVID situation across the world. In some other countries, people were dying. In fact, in some countries, at some point, they left people of certain age to die because there was no space to keep them. We shut down our economy. We shut down our country. We closed down our schools. Ghana, we had to recruit more health professionals when we had not budgeted for them and had no money for them. We had to incentivize our frontline professionals at a time when we had not prepared for it. Our economy and our society was disrupted. Now me MC, every baby no, yenam schools in the airport, just a woman from dormitories and your isolation centers. Empo say obi ye asymptomatic and when you COVID no show symptoms, near person isolate here. As an MC, the district or the municipality, your top provisions, and they do an emano. Your man on the Paduane, a Viadiane, and I get any, and will be fee. No what top provisions, now they are common. We struggled to ensure that we contain the COVID situation. Hospitals didn't have enough beds. We were using hotels to keep people. COVID, say, the much touted health infrastructure, not NDC focus on my enemy. It was a complete facade. So we don't see the gap that was in existence. COVID, who say, hey, so my 88 of your districts need hospital. 88 districts did not have hospital in this country. Meanwhile, you say CHIPS compound, health center, clinic, polyclinic, and a district hospital. Every district must have a district hospital. Imagine this: a free Okre district assembly. Obaba Ekwapem North, Waba Ekwapem South, Waba Adenta municipality, now Waba Madina municipality. 1, 2, 3, 4, 5. All these district assemblies, we had only one district hospital, Tetekwashi Memorial Hospital in Ekwapem North. And see, Obi Yare wa Madina, not per district hospital, not the Numachi Ekwapem North, Adenta Ekwapem North, Ekwapem South, Ekwapem North, Okre Ekwapem North. And yet, the Tetekwashi Memorial Hospital itself, the number of beds or one is so the pressure was enormous. During COVID, we realized that this country was not ready to ensure that we safeguard the health of our people in times of emergency. We didn't have any, what you say, yeah, ready cry. Now, meaning say, yeah, you're ready for COVID situation now. And I don't know if we have some videos on COVID that you bet to me sure. If we have, let's just show just some few seconds of the COVID situation, and then we'll come back to the conversation. Isolation centers, makeshift isolation centers, and we had to create at that time. This is what we had to be confronted with. Government had to overspend, overrun our budget. We had to do everything we had to do to save lives. Our doctors and our nurses had to put their lives on the line. Your doctor for the nurse will be almost sure in the process of saving lives. We have families and friends. That is how difficult and how tough it was for the world during the COVID period. Countries like Italy, countries like Spain, at some point they were allowing people of certain age to die because space and it was a difficult period at that time. It was a difficult period for us as a country. Patients were sleeping in classrooms. Patients were sleeping on floors. Children stayed at home for a year, and we still had to pay teachers and still had to make sure that these children had some interventions. It was therefore, this is what brought about the need to ensure that the call through 2020, by a sign bar, we have to be ready as a country. Now the WHO crab boy abaso, you didn't see your video no and not pictures no but the WHO actually said when it comes to this country, Ghana, a quite first way to manage COVID down a year strong. If I mention the WHO video no quickly.
The coronavirus pandemic so far, with Ghana's testing capacity especially singled out as one of the best in Africa. Government has received praise and criticism in equal measure for its methods in dealing with the crisis, with the opposition saying government has been slow. Well, the government has rejected that claim, saying WHO Country Director for Ghana, Dr. Nima Kimambo, has also been speaking exclusively to Joy News on this.
As you have seen, the government has been providing a lot of briefings on the situation of COVID. The daily numbers are shared, and we think this is a good thing for countries to be transparent, and the fact that even these numbers are shared daily on websites. The government continues to do testing, and it's also, Ghana is also one of the countries that has done among the highest number of tests, and this is good because the more you test, then you are able to identify cases and you're able then to isolate.
Based on situation here, COVID by NT, Nana Akufo-addo announced in the middle of the crisis, and that's what I keep saying. Say that is the biggest difference between the MPP and NDC. In the midst of the crisis, we didn't throw our hands in the air. And Akufo-addo said, no, we cannot continue like this. We need to ensure that we fix this infrastructural fundamental gap once and for all. This should be a day. Say the will be in district and code district for Obi a day. Sani a health system no. Until you make sure so be now Obi the training for because it's very painful. Say the what district A. Now me who can make hospital or me district. Now why am I because other people from district B and C aba. So we needed to fix this. And so Nana Akufo-addo announced in the middle of the crisis, that we had to ensure that we put up infrastructure at all the district hospitals, 88 now. We realized that there are certain regions where you need regional hospitals, and also there are certain mental health hospitals also, so that once and for all, we can fix our infrastructural gap. This is the most audacious investment in our health sector when it comes to infrastructure since 1992, at least. No government, No government since 1992 has pursued such an audacious investment like we have. Yes, as usual, just as they always say, Agenda 111, constructing over 80 hospitals at the same time is unreasonable, Mahama. Everything is impossible for them. This is the Garu District Hospital. Yaboso. Yeye fittings. Yeye finishing. This is the Abumusu District Hospital. Okre District Hospital. Okre the Miami Krum. And now Okoha. Omaye installing beds, medical equipment, and work inside. Nukra Dada. Achiase District Hospital. Akim Swedro District Hospital. Now the NDC are telling us, it's an 111, and I say 88 District Hospital. But I can tell you, each of the 88 district hospitals are at different stages of completion. I'm coming to say, or can see in 18 months. I'm missing a question. Tema West, a district no money hospital, no, just one hospital. But what the withdrawings are, Okwakosi District Hospital, we did Tema West. We do Tema West, we will say, Landa, Yadibeyas our project, no, anyhow. Tema West needs a district hospital, but they don't have the land. So what would you do? You have to spend time to look for the land. It's all Tobas in our past. Some of them, like Tema West in Podier, it's an assassin Munti, Assassin Obediano, and yet can see it to send your plan is it, Until I say, taking capital on the science so much. No more sign best start drawing, no more draw building a best city Tema West for assassin. Wako Adeso, Upper West Akem, Ukosi District Hospital, Ukoyano, Assassina district in Mauno. There are rocks, big rocks in the land. So it takes you about 3-4 months before you're able to prepare the land and take off. Then, Ubiabe catch. If there are even some districts, if you can land, are you available? Then Ubiabe catch say, it's not a case of 18 months when we ain't. You are in Bugos. It was your for history will forever remember this government. That there was once a government that decided, say, district be a general hospital, and the government went ahead to make that investment to ensure that every district in Ghana will have their hospital. Posterity would always remember this government. Not recruitment. As we speak, 152,472 health professionals and are by we if 2017 EBA 2022 we are recruiting 152,000 every year. 2017 10,000, 2018 11,000, 2019 40,000, 2020 58,000, 2021 26,000, 2022 6,780, 152,000 health professionals. The abai yan say or per se a lot more health professionals na a reduce nipa dodoa ekobo peso eko doctor ba ko pe won nti enyi me no ka say doctor to patient ratio between 2009 and 2016 as at 2016 there 8,301 and it's the number of health professionals about we have about a health system in Minti eko 4,992 emu achemienu ye reduce doctor ba ko nipa dodoa o hwe do achemu mienu. That is the impact we are giving to our health sector. Nurse for 1 to 834 and then 1 to 524, almost about 300. And I buy at TF nurse back also. And now the nurse baby abede ababeka ho. We just call card no. Doctor strike is illegal. We can't negotiate under duress. MPP is recruiting. NDC is complaining. MPP is picking them. NDC is complaining. And 2016, a medical officer on the number around 5,200 salary, and they abaya to muko 3,406. What to mu first year house officer, non salary and about 2,800 Ghana cedis, and then abaya the kobe 8,800 Ghana cedis. Physician assistant now on the 2,500, abaya double no, 5,000 Ghana cedis. Registered nurse now on the number 1,900, and then abaya the 4,000 Ghana cedis. MPP abaya improve yen conditions no na mahama mom warning say oni omo nika se bia ni nkobodie bia oni omo ni bibia omobeka. That is the biggest difference between the MPP government and the NDC government. This is our report. This is our scorecard. 111 hospitals under construction, 6 zipline distribution centers that have so far provided 17 million Ghanaians with the needed medical support, 424,000 medical deliveries made by zipline drones as at August 2023, 3.3 million units of medical product delivered nationwide by the zipline drones, 2,694 health facilities onboarded on the zipline drone services, 10 million vaccines delivered by the 10 million 579 vaccines and a zipline is a zipline SBM crashing chips compound near health centers a way cheaper zipline a supply of Munyama over 400. Yet the ambulance 307 and Abba ambulance stations no yet the Bibri Ababe count about 297 and a Ababe count ambulance service response to cases economy preocupe national health insurance a movie from 11 million equal about 17.2 million. Ladies and gentlemen, this is our scorecard. This is why we believe we are a better alternative to the opposition. There are a lot of challenges, there are a lot of difficulties, but this is where we are. We need to protect this achievement. We need to consolidate these gains. And the person who would help us consolidate these gains is the flag bearer of the New Patriotic Party, Dr. Mahmoud Bawumia. Dr. Mahmoud Bawumia say, Yamano Kwai, na ene pa yashasi ye no, on fambe to us no mewie. Yamano Kwai, na oma ambulances ni bi embeka ho. Yamano Kwai, na e-health system no, umbi mu na enkudu the chips level. Yamano Kwai, na doctor to patient ratio no, ye improve no. Yamano Kwai, na ambulance to citizen ratio no, yamfambra below the 25,000 global standard. Yamano Kwai na protected the health and the life of the Ghanaian. He is making a solemn promise to us. Say, there were difficulties, there were challenges, there were a lot of challenges as we speak as a country, just like all other countries. But he's making a solemn pledge to us. Say, in spite of these challenges, in spite of these difficulties, in spite of all the difficulties that we are in as a people, he's making a solemn pledge. Say, he will protect our health. He will be there for us. He would ensure that no Ghanaian loses his life, 1, because he doesn't have money, 2, because there is no health facility, 3, because we didn't create the needed space for this Ghanaian person to have access to the needed health service. This is the next chapter of Ghana's development, Dr. Mahmoud Bawumia is promising. Ebusiafo, Machel, the scorecard, very confident in it. No insult, no propaganda, no twist, no skill. Pure fact and numbers. I can tell you, say, we have done more for health than the NDC have done. It is a Okotuaba, now to Dr. Mahmoud Bawumia and John Mahama, and ballot papers. You have a reason to vote for Dr. Mahmoud Bawumia because you can trust him, you can believe in him, and you can be rest assured, say, Obebody I am not by now ODB Ababeka. Say